Diabetes is a condition that affects how your body uses sugar. This sugar is called glucose. Glucose is very important. It is the main source of energy for your body's cells. We get glucose from the foods we eat, especially carbohydrates. When you eat, your body breaks down food into glucose. This glucose then enters your bloodstream. Your body needs to move this glucose from the blood into your cells. This is where insulin comes into play. Understanding this process is the first step to understanding diabetes and how to manage it effectively for a healthier life. Insulin is a very important hormone. It acts like a key. Your pancreas, an organ located behind your stomach, makes insulin. When glucose enters your bloodstream after a meal, the pancreas releases insulin. This insulin travels through your blood to your cells. It then helps unlock the cells so glucose can enter. Once inside the cells, glucose can be used for energy right away, or it can be stored for later use. This system usually works very well to keep blood sugar levels in a healthy range, providing steady energy throughout your day. Sometimes, this system does not work correctly. This is what happens in diabetes. Either the pancreas does not make enough insulin, or the body's cells do not respond to insulin properly. This is called insulin resistance. In both cases, glucose cannot get into the cells easily, so it stays in the blood. This causes blood sugar levels to become too high. High blood sugar for a long time can lead to serious health problems. These problems can affect your heart, kidneys, eyes, and nerves. It's a serious condition that requires careful attention. Managing diabetes is very important for your health. The main goal is to keep blood sugar levels as close to normal as possible. This can help prevent or delay long-term complications. Good management involves several things. These include healthy eating habits. Regular physical activity is also key. Sometimes medication or insulin injections are needed. With the right knowledge and tools, people with diabetes can live long and healthy lives. It is about making consistent, positive choices every day. Learning about your condition is a powerful step forward. Type 1 diabetes is a type of diabetes that is different from type 2. It is an autoimmune condition. This means the body's immune system makes a mistake. The immune system normally fights off harmful bacteria and viruses. In type 1 diabetes, it attacks and destroys the insulin-producing cells in the pancreas. These cells are called beta cells. When these cells are destroyed, the pancreas can no longer make insulin, or it makes very little insulin. This process can happen over weeks, months, or even years. It is not caused by what you eat or your lifestyle. Type 1 diabetes often develops in children and young adults. However, it can appear at any age. It used to be called juvenile diabetes because it was commonly diagnosed in youth. It is much less common than type 2 diabetes. Only about 5 to 10% of people with diabetes have type 1. Scientists believe that genetic factors play a role. Environmental factors like certain viruses might also trigger it in people who are already at risk. It's important to remember that it's not anyone's fault if they develop type 1 diabetes. It's a complex condition. People with type 1 diabetes need to take insulin every day to survive. Since their bodies do not produce insulin, they must get it from an outside source. This is usually done through insulin injections. Some people use an insulin pen, others use an insulin pump. An insulin pump is a small device that delivers insulin continuously throughout the day. Careful blood sugar monitoring is also essential. People with type 1 diabetes must balance their insulin doses with the food they eat and their physical activity levels. It is a lifelong condition requiring constant management. There is ongoing research into type 1 diabetes. Scientists are working hard to find a cure. They are also looking for ways to prevent it. In the meantime, treatments and management tools have improved a lot. People with type 1 diabetes can live long, active, and healthy lives. This requires careful management and regular medical care. Education about the condition is very important. Support from family, friends, and healthcare providers also makes a big difference. There is hope for even better ways to manage and potentially cure type 1 diabetes in the future. Type 2 diabetes is the most common form of diabetes. About 90 to 95% of people with diabetes have type 2. In this condition, the body does not use insulin properly. This is called insulin resistance. At first, the pancreas tries to make extra insulin to overcome this resistance. It works harder to keep blood sugar levels normal. However, over time, the pancreas cannot keep up. It cannot make enough insulin to meet the body's needs. As a result, blood sugar levels rise. This is different from type 1, where the body doesn't produce insulin. Several factors can increase your risk of developing type 2 diabetes. Being overweight or having obesity is a major risk factor. Carrying extra weight, especially around the abdomen, makes cells more resistant to insulin. A family history of diabetes also increases your risk. If your parents or siblings have it, you are more likely to develop it. Older age is another factor. Risk increases as you get older. Lack of physical activity can contribute too. An unhealthy diet, high in processed foods, sugar, and unhealthy fats, also plays a significant role in its development. Type 2 diabetes often develops slowly over many years. Many people may have it for a long time without knowing. The symptoms can be mild at first, or they may not be noticeable at all. This is why regular checkups and screenings are important, especially if you have risk factors. Early diagnosis allows for earlier treatment. This can help prevent or delay serious complications. Complications can include heart disease, kidney problems, nerve damage, and eye problems. Knowing your risk and getting checked can protect your long-term health significantly. Managing type 2 diabetes often starts with lifestyle changes. Healthy eating is crucial. This means choosing foods that help control blood sugar. Regular physical activity is also very important. Exercise helps your body use insulin more effectively. It can also help with weight management. For some people, lifestyle changes are enough to manage their blood sugar. Others may need oral medications. Some may eventually need insulin injections. Working closely with a healthcare team is essential to create a personalized management plan that suits individual needs. Gestational diabetes is a type of diabetes that occurs during pregnancy. It means having high blood sugar levels that develop while a woman is pregnant. It typically affects women who did not have diabetes before they became pregnant. The condition usually appears in the middle or later stages of pregnancy. This is often around the 24th to 28th week. Doctors routinely screen pregnant women for gestational diabetes. This is important because managing it properly helps protect both the mother and the baby. It's a temporary condition for many, but it needs careful attention. During pregnancy, a woman's body goes through many changes. The placenta produces hormones that help the baby grow. These hormones can also make the mother's cells more resistant to insulin. This is a normal part of pregnancy to some extent. It helps ensure the baby gets enough glucose. However, sometimes the mother's pancreas cannot produce enough extra insulin to overcome this resistance. When this happens, blood sugar levels rise too high. This leads to gestational diabetes. Not all pregnant women develop it, but certain risk factors increase the chance. Gestational diabetes can pose risks for both the mother and the baby if not managed. For the baby, it can lead to growing too large. This is called macrosomia. A large baby can make delivery more difficult. It can also increase the risk of birth injuries. The baby may also have low blood sugar shortly after birth. For the mother, gestational diabetes increases the risk of high blood pressure during pregnancy. It also raises her risk of developing type 2 diabetes later in life. This makes follow-up care after pregnancy very important. The good news is that gestational diabetes can be managed effectively. Management usually involves a healthy eating plan. Regular, gentle physical activity is also recommended, if approved by the doctor. Monitoring blood sugar levels at home is often necessary. Some women may need medication, such as metformin, or even insulin injections, if diet and exercise are not enough to control blood sugar. For most women, gestational diabetes goes away after the baby is born. However, it is a warning sign. These women should continue to make healthy lifestyle choices to reduce their future risk of type 2 diabetes. Section 5. Recognizing the signs, common symptoms of diabetes. Knowing the common symptoms of diabetes is very important. Early detection can make a big difference. When diabetes is diagnosed early, treatment can start sooner. This helps to manage blood sugar levels effectively. It can also help to prevent or delay serious health problems. These problems are often called complications. Sometimes people ignore early symptoms. They might think they are just tired or stressed. But paying attention to your body and recognizing these signs is crucial for your health. It empowers you to seek medical advice promptly. One of the most common symptoms is feeling very thirsty all the time. This is known as polydipsia. Along with increased thirst, you might find yourself urinating more often than usual. This is called polyuria. This can be especially noticeable at night, waking you up multiple times. Another key symptom is feeling very hungry even if you are eating regularly. This is known as polyphagia. Some people also experience unexplained weight loss. This happens because the body cannot use glucose for energy, so it starts breaking down muscle and fat instead. Other symptoms can also indicate diabetes. Feeling very tired or fatigued is common. This is because your cells are not getting enough glucose for energy. Blurred vision can occur. High blood sugar can cause the lens of your eye to swell. This can temporarily affect your ability to see clearly. You might also notice that cuts or sores take a long time to heal. Frequent infections can also be a sign. These can include skin infections, yeast infections, or urinary tract infections. These symptoms might develop slowly, especially in type 2 diabetes. If you experience any of these symptoms, it is important to see your doctor. Do not try to diagnose yourself or ignore the signs. Your doctor can perform simple tests to check for diabetes. A blood test can measure your glucose levels. If diabetes is diagnosed, your doctor will help you create a plan to manage it. Remember, recognizing symptoms early and getting treatment can help you stay healthy. It is always better to get checked if you have any concerns about your health. Taking action early is a key step in managing diabetes well. Section 6. Preventing type 2 diabetes. Healthy choices matter. The good news about type 2 diabetes is that it is often preventable. Many cases can be avoided or delayed. This is possible by making healthy lifestyle choices. Even if you have risk factors, such as a family history, you can still take steps to reduce your risk. Small changes in your daily habits can add up to a big impact on your health. Focusing on prevention is a powerful way to protect yourself. It's about being proactive and taking control of your well-being. This approach can lead to a healthier future. Healthy eating plays a very important role in preventing type 2 diabetes. Focus on eating whole, unprocessed foods. This includes plenty of fruits and vegetables. Choose whole grains like oats, brown rice, and whole wheat bread instead of refined grains. Legumes such as beans, lentils, and chickpeas are also excellent choices. They are high in fiber. Fiber helps to slow down sugar absorption and keep you feeling full. It is also important to limit sugary drinks like soda and fruit juices with added sugar. Reduce your intake of processed foods, which are often high in unhealthy fats, sugar, and salt. Regular physical activity is another key factor in prevention. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week. This could be 30 minutes a day, 5 days a week. Brisk walking is a great way to start. Other good activities include cycling, swimming, or dancing. Find activities that you enjoy. This will make it easier to stick with them. Exercise helps your body use insulin more effectively. It also helps you maintain a healthy weight. Even short bursts of activity throughout the day can be beneficial for your health. Maintaining a healthy weight is crucial for preventing type 2 diabetes. If you are overweight, losing even a small amount of weight can make a big difference. Losing 5 to 7% of your body weight can significantly reduce your risk. For example, if you weigh 200 pounds, losing 10 to 14 pounds can help. Focus on gradual, sustainable weight loss. This is usually more effective than quick fixes. A combination of healthy eating and regular physical activity is the best way to achieve and maintain a healthy weight. Talk to your doctor or a dietitian for personalized advice. Section 7. Eating well with diabetes, fueling your body right. When you have diabetes, what you eat is very important. Your diet directly affects your blood sugar levels. Making healthy food choices is a cornerstone of diabetes management. It helps keep your blood sugar in your target range. Eating well also provides your body with the nutrients it needs. This helps you feel energetic and maintain overall health. It is not about deprivation. It is about making smart, balanced choices that you can enjoy. A healthy eating plan can be delicious and satisfying while helping you manage your condition effectively. A plant-rich diet can be very beneficial for managing diabetes. Focus on eating plenty of non-starchy vegetables. Examples include broccoli, spinach, peppers, and carrots. Include fruits in moderation. Whole grains like oatmeal, quinoa, and brown rice are good choices. Legumes such as beans, lentils, and chickpeas are excellent sources of fiber and protein. These plant-based foods are generally low in fat and high in nutrients. The fiber in these foods helps to slow down the absorption of sugar. This can prevent sharp spikes in your blood sugar levels after meals. It is also important to limit or avoid certain foods. Reduce your intake of sugary foods and drinks. This includes candy, cookies, cakes, regular soda, and sweetened fruit juices. These can cause your blood sugar to rise quickly. Be mindful of highly processed foods. They often contain hidden sugars, unhealthy fats, and a lot of sodium. Limit unhealthy fats, especially saturated fats and trans fats. Saturated fats are found in red meat and full-fat dairy products. Trans fats are often in fried foods and some packaged snacks. Choose lean proteins like fish, poultry without skin, and plant-based proteins. Meal planning and portion control are very helpful tools. Planning your meals ahead of time can help you make healthier choices. It can also prevent you from grabbing unhealthy options when you are hungry. Paying attention to portion sizes is key. Even healthy foods can raise your blood sugar if you eat too much. Using smaller plates can sometimes help with portion control. Learning to read food labels is also important. It helps you understand what is in the food you are eating. A registered dietitian can provide personalized advice and help you create a meal plan that works for you. Section 8. Managing diabetes, exercise, monitoring, and support. Regular physical activity is vital when you have diabetes. Exercise helps your body use insulin more effectively. This means your cells can take up glucose from your blood more easily. This, in turn, helps to lower your blood sugar levels. Exercise can also help you manage your weight. It improves your heart health and boosts your mood. Aim for a mix of different types of activities. Aerobic exercises like brisk walking, jogging, swimming, or cycling are great. Strength training, using weights or resistance bands, at least twice a week, helps build muscle. Muscle uses more glucose than fat. Monitoring your blood sugar levels is a critical part of diabetes management. Checking your blood sugar at home gives you valuable information. It shows you how your body responds to different foods, physical activity, stress, and medication. Your doctor or diabetes educator will tell you how often to check. They will also help you understand what your blood sugar numbers mean. Keeping a record of your readings can help you and your healthcare team see patterns. This information can be used to adjust your treatment plan as needed for better control. It empowers you to take charge. Many people with diabetes need medication to help manage their blood sugar. This might include oral medications, insulin injections, or other injectable medicines. It is very important to take your medications exactly as prescribed by your doctor. Do not skip doses or change your medication without talking to your doctor first. Regular visits to your healthcare team are also essential. These checkups allow your doctor to monitor your A1C levels, blood pressure, cholesterol, and check for any complications. They can make adjustments to your treatment plan to ensure it is working effectively for you. Managing diabetes can sometimes feel overwhelming. Having a good support system is incredibly helpful. Family and friends can offer emotional support and encouragement. They can also help you stick to your healthy lifestyle changes. Diabetes education programs are very valuable. They provide information about managing diabetes, healthy eating, exercise, and coping strategies. Connecting with other people who have diabetes can also be beneficial. Support groups offer a place to share experiences and learn from others. You are not alone on this journey. Reach out for support when you need it. Section 9. Living a full life with diabetes. A hopeful outlook. Having diabetes means you need to manage your health carefully, but it does not mean you cannot live a full and active life. With good management, diabetes can be controlled effectively. You can continue to do the things you enjoy. You can pursue your goals and dreams. It requires commitment and effort, but it is possible. Many people with diabetes lead very healthy and fulfilling lives. The key is to learn about your condition and work closely with your healthcare team. Your attitude and approach play a big role in your success. Focus on the positive aspects of the lifestyle changes you make. Healthy eating and regular exercise are not just for managing diabetes. They benefit your overall health and well-being in many ways. These changes can give you more energy. They can improve your mood. They can reduce your risk of other health problems like heart disease. Think of managing diabetes as an opportunity to invest in your long-term health. Every healthy choice you make is a step in the right direction. Celebrate your successes along the way, no matter how small they seem. Empowerment comes from knowledge. The more you learn about diabetes, the better equipped you will be to manage it. Understand how different foods affect your blood sugar. Learn how exercise impacts your levels. Know the signs of high and low blood sugar and what to do. Ask questions when you visit your doctor or diabetes educator. Be an active participant in your care. When you understand your condition, you can make informed decisions about your health every day. This sense of control can be very empowering and motivating. Remember, you are not alone in managing diabetes. Millions of people around the world live well with this condition. There are many resources available to help you. This includes healthcare professionals, support groups, and educational materials. Stay positive and proactive in your approach. Effective management is a journey, not a destination. There will be ups and downs, but with persistence, you can manage diabetes effectively. This will allow you to enjoy a healthy, vibrant, and fulfilling life for many years to come. Keep learning, keep adapting, and keep striving for your best health.